Hello, I'm Dr. Sithira Seneviratne. I'm consultant geriatrician from Sri Lanka. We often get asked who should receive high protein foods and fluids. First, everybody with a recent hip fracture should be given high protein food and fluids. This helps recovery. Keep offering them until the patient is assessed as well nourished and is eating and drinking well. Second, think about anybody else at risk of malnutrition. This includes patients who are not eating and drinking well, or those who screen at risk using a hospital's nutrition screening tool. Finally, if someone has been assessed and diagnosed as malnourished, offering high protein foods and fluids is usually essential. Malnutrition should be diagnosed using a proper tool like GLIM, MNASF, or SDA. Don't just rely on BMI or blood test results. They don't really tell the full story. So, if in doubt, offer high protein nutrition early and check if more support is needed. There are a few simple ways we can check if patients are actually receiving high protein foods and fluids. First, audit 10 charts. Look at the notes. Is there documentation that high protein or energy foods and drinks were provided? Has food and fluids intake been assessed? Second, ask 10 patients. Find people who can remember well and ask them, are you receiving high quality, high protein food and fluid choices? Has anyone asked you how much you have been eating? Third, survey 10 clinicians. At a team meeting, do a quick poll. Ask your team what proportion of fracture patients have received high protein foods and fluids and have had their intake assessed within 72 hours of surgery. These quick checks help us know if your nutrition care is being delivered as planned. Let's look at an example, the story of Mrs. D. If you have already seen Mrs. D's case in another unit, you might still want to see it to think about opportunities for improvement to receiving high protein foods and fluids. As you watch, think about what could have been done differently and how her experience might have been improved. Receive high protein foods and fluids is a simpler sixth action. This action reminds us how important it is to give high protein food and fluids to all patients with a hip fracture until they have been assessed as well nourished and not at risk of malnutrition. However, in many settings, around half of patients with hip fractures do not receive high protein foods and fluids. And we know that unless we do this, hip fracture patients rarely meeting their requirements for protein. Why does it matter? It's a simple action with low risk, but it can make a big difference. It's recommended in nutrition and hip fracture guidelines. It helps prevent and treat malnutrition. Getting enough protein helps keep muscles strong so patients can get moving sooner. It also reduces the chances of problems like pressure injuries, infections, and delays. Getting enough protein and nutrition in general is essential to support better healing and recovery. Even small changes like choosing higher protein meals or adding protein-rich drinks can make a big impact. Everyone in the team can help make sure this happens at meals, on ward rounds, and when planning care. Let's look at why high protein foods and fluids are important from the patient's point of view. It's not just about calories or numbers on a chart. It's about helping people feel seen, supported, and able to heal. For patients, good food and drink can show respect. It gives them choice and helps them feel like they can do something active to support their own recovery. It can also change how they think about meals, turning food into medicine. High protein foods can lift their mood, improve appetite, and give them the strength they need to do rehabilitation. It helps keep their muscles strong and lower the risk of malnutrition, dehydration, and complications. And most importantly, it helps them heal, recover faster, and have a better chance to return home and stay at home for a longer period. So every time we offer a patient a high protein meal or drink, we are not just giving them food, we are supporting their dignity, their independence, and their chances to recover. Let's now take a look at why providing high protein foods and fluids should matter to health professionals, hospitals, and the wider health system. When patients are offered high quality, high protein foods and fluid choices, they are much more likely to meet requirements for protein and energy. Intakes can be even higher when the right food and fluids are offered in the right environment, with encouragement, assistance, and adequate time to eat and drink. Meeting protein and energy intakes can help speed up recovery and reduce the number of days spent in hospital. It supports patients to meet their rehabilitation and discharge goals. Fewer complications and readmissions also means less pressure on staff and more time to focus on what matters most. These actions can help free up beds, ease the strain on clinical teams, and improve overall confidence and job satisfaction. Finally, this can help hospitals strengthen their performance in key areas like safety, quality, audits, and national benchmarking across a large number of performance measures. Received high protein foods and fluids is a key, simpler action that can lead to better nutrition and better outcomes for everyone involved. It's time to reflect. Why do you think it is or it isn't important for all hip fracture patients to be offered high protein foods and fluids? Think about things that matter to the patients, communities, or populations, healthcare workers, or funders and policymakers. Just put in a few of your thoughts. This is not assessed, it's just to get you thinking. Once this video stops, just click on the link to the reflection activity.